Welcome to this pharmacology quiz where we test your knowledge on key drug classes. In this video, we focus on the topic of adrenoceptor blockers and their clinical relevance. These drugs are commonly used to manage conditions such as hypertension, heart failure, arrhythmias, and benign prostatic hyperplasia. This quiz consists of 10 recall-type multiple-choice questions designed to reinforce key concepts. Each question presents 5 options followed by the correct answer and a brief explanation. The video will pause briefly after each question to allow you time to attempt an answer before the correct option is revealed. So, let's get right into it. Question 1. Which of the following statements about beta-1 selective adrenoceptor blockers and their mechanism of action is correct? Option A. They selectively block cardiac beta-1 receptors at low doses. Option B. They block beta-2 receptors predominantly in bronchial smooth muscle. Option C. They increase heart rate through sympathetic stimulation. Option D. They directly activate adenylate cyclase in cardiomyocytes. Option E. They inhibit renin release via beta-2 receptor blockade. The correct answer is option A. They selectively block cardiac beta-1 receptors at low doses. This is because beta-1 selective blockers primarily act on cardiac beta-1 receptors, reducing heart rate and contractility. All other options are incorrect as they either involve beta-2 effects, stimulation rather than blockade, or incorrect mechanisms. Question 2. Which of the following drugs is most likely to exhibit intrinsic sympathomimetic activity among beta-adrenoceptor blockers? Option A. Propranolol. Option B. Atenolol. Option C. Pindolol. Option D. Metoprolol. Option E. Nadolol. The correct answer is option C. Pindolol. The explanation is that pindolol partially stimulates beta receptors while blocking them, demonstrating intrinsic sympathomimetic activity. All other options lack intrinsic sympathomimetic activity and act as pure antagonists at beta receptors. Question 3. Which one of the following statements about lipophilic beta blockers and their pharmacokinetics is correct? Option A. They undergo extensive hepatic first-pass metabolism. Option B. They are eliminated unchanged primarily via kidneys. Option C. They have minimal central nervous system penetration. Option D. They have longer half-lives than hydrophilic agents. Option E. They are poorly absorbed from the gastrointestinal tract. The correct answer is option A. They undergo extensive hepatic first-pass metabolism. This occurs due to their high lipid solubility, leading to significant liver metabolism before systemic circulation. All other options describe hydrophilic agents or incorrect pharmacokinetic properties. Question 4. Which of the following drugs is most appropriate for topical treatment of glaucoma due to reduced aqueous humor production? Option A. Labetalol. Option B. Timolol. Option C. Propranolol. Option D. Esmolol. Option E. Acebutolol. The correct answer is option B. Timolol. This is because timolol is a non-selective beta blocker that decreases intraocular pressure by reducing aqueous humor formation. All other options are not suitable or commonly used for topical glaucoma treatment. Question 5. Which of the following statements about alpha-1 adrenoceptor blockers and their therapeutic uses is incorrect? Option A. They reduce peripheral vascular resistance in hypertension. Option B. They improve urinary flow in benign prostatic hyperplasia. Option C. They commonly cause reflex tachycardia after first dose. Option D. They decrease bladder outlet obstruction by relaxing smooth muscle. Option E. They increase renin release through alpha-1 receptor stimulation. The correct answer is option E. They increase renin release through alpha-1 receptor stimulation. The reason is that alpha-1 blockers do not stimulate renin release. Instead, renin regulation is mainly beta-1 mediated. All other options correctly describe the therapeutic effects and side effects of alpha-1 blockers. Question 6. Which of the following drugs is most suitable for rapid short-term beta blockade due to its very short half-life? Option A, atenolol. Option B, propranolol. Option C, esmolol. Option D, bisoprolol. Option E, nadolol. The correct answer is option C, esmolol. This is because esmolol is rapidly metabolized by red blood cell esterases, giving it an ultra-short duration. All other options have longer durations and are unsuitable for rapid short-term control. Question 7. Which of the following statements about beta blockers in heart failure and their clinical use is correct? Option A. They reduce mortality in stable chronic heart failure. Option B. They are contraindicated in all heart failure patients. Option C. They increase myocardial oxygen demand significantly. Option D. They worsen survival when used with ACE inhibitors. Option E. They should only be used in acute decompensation. The correct answer is option A. They reduce mortality in stable chronic heart failure. This is because certain beta blockers improve survival by reducing sympathetic overactivity in stable heart failure. All other options are incorrect as they contradict established therapeutic benefits or proper clinical use. Question 8. Which of the following is not a correct statement regarding non-selective beta blockers and their pharmacological effects? Option A. They block both beta-1 and beta-2 receptors. Option B. They may precipitate bronchospasm in asthmatics. Option C. They reduce renin secretion from the kidney. Option D. They increase glycogenolysis via beta-2 stimulation. Option E. They decrease heart rate and myocardial contractility. The correct answer is option D. They increase glycogenolysis via beta-2 stimulation. This is because non-selective beta blockers inhibit beta-2 receptors, reducing glycogenolysis rather than increasing it. All other options correctly describe the pharmacological effects of non-selective beta blockers. Question 9. Which drug among the following is most appropriate for rate control in atrial fibrillation, compared with a calcium channel blocker? Option A. Verapamil. Option B. Sotalol. Option C. Propranolol. Option D. Amlodipine. Option E. Nifedipine. The correct answer is option C. Propranolol. The explanation is that propranolol slows atrioventricular nodal conduction, effectively controlling ventricular rate in atrial fibrillation. All other options are either calcium channel blockers or not effective for rate control. Question 10. Which one of the following statements about alpha and beta mixed adrenoceptor blockers and their pharmacological properties is correct? Option A. Labetalol blocks both alpha-1 and beta receptors. Option B. Atenolol blocks alpha-1 and beta-1 receptors equally. Option C. Propranolol selectively blocks alpha-1 receptors. Option D. Prazosin blocks both alpha and beta receptors. Option E. Metoprolol blocks alpha-2 receptors predominantly. The correct answer is option A. Labetalol blocks both alpha-1 and beta receptors. This is because labetalol has combined alpha-1 and non-selective beta blocking activity, useful in hypertension management. All other options incorrectly describe receptor selectivity or drug classifications. The quiz is now complete, and thank you for taking part in this session on adrenoceptor blockers. Don't forget to drop your score in the comments so we can see how you performed. To deepen your understanding, consider reviewing Katzung and Trevor's Clinical Pharmacology, Rang and Dale's Pharmacology, and the British National Formulary. Any guideline references discussed are aligned with the BNF to support clinical relevance and accuracy. Subscribe for more high-yield pharmacology content to keep advancing your learning.